How do I know that my ability to use my arm or to walk better is really improving with the rehabilitation I'm receiving? Well, the answer to improving the rehabilitation and the outcomes of the treatment of your hand and your upper extremity it's really quite simple. And you need to ask yourself as the patient or as the provider of care for a patient, what can I do now that I couldn't do yesterday or before this treatment? And by that, we're not talking about something spectacular right away, like I can now brush my teeth where I couldn't hold a toothbrush before. But we're talking about our very small, graded steps of improvement. Say, using the toothbrush example, my ability to first grasp the toothbrush and release it, my ability to bring it to my mouth, then my ability to actually move back and forth in a coordinated fashion, then my ability to do that with real toothpaste on the toothbrush so it doesn't spill. These are fine graded steps that are put together piece by piece, movement by movement, into a total whole, so that the answer is not, I can now brush my teeth when I couldn't do that yesterday. The answer might be, I can now pick up a toothbrush and bring it to my mouth when I couldn't do that yesterday. And that's because I had some very specific training on how to relax certain muscles and how to increase the activity in other muscles. So the important thing to remember is that one must understand gradations, changes in improvement, and that these come very gradually. They don't come dramatically, suddenly. Each takes time, repeated practice, and the ability to recognize that you can now do something that you couldn't do before with a certain specific goal in mind.